Hi, in today's video we'll learn about sciatica, which is a very common problem we face today. So, what is sciatica and what are its symptoms? Sciatica is a common man term. So, whenever there is a disc problem in the lower back which prolapses out or protrudes out and touches the nerves, it causes intense pain in the legs. Starts from the lower back in the gluteal region and the back of the thigh coming to the calf and feet. So this type of pain coming from the lower back till the legs, we term it as sciatica. It means that previously they used to think that sciatic nerve gets compressed, that's why we call it as sciatica. The symptoms might vary person to person. Sometimes the pain is only in the gluteal region, sometimes pain is more in the calf, sometimes its entire limb is painful. This is what sciatica means. So, what are the causes for this sciatica or what contributes this sciatic symptoms? Normally 90% of the time it is because of the problem in the lower back spine, especially the disc. Either it prolapses out because of acute trauma or it can come out due to degeneration. This presses the nerve, causing sciatica. The other causes are elderly patient where a part of degeneration, the disc or the facet joints or the bone extra growth from the vertebra causes narrowing of the canal and causes symptoms of sciatica. Very rarely it might be because of the tumors, patient can have a sciatic symptoms. So how do you differentiate between a sciatica and other causes of back pain? In all other causes of back pain, either be a muscle pain, bone pain, or a ligament pain, or a nerve pain, it's only in the back. The moment we say sciatica, it should start in the back and come down the legs. These are the basic differences. Back pain will be only in the back. Sciatic pain, it comes down from the back till the leg. That's called sciatic pain. So once diagnosed with sciatica, what are the steps we take for the management? Any patient with sciatic symptoms who comes to any doctor or a primary physician, first the clinical examination is done just to assess where is the pain coming from. Is it in the lower back, in the mid back, or in the upper back? If it is from the lower back, on clinical examination, we can come to a diagnosis. Probably there is something compressing the nerve in the lower back causing sciatic symptoms. If symptoms are mild, then we just treat them with medicines, rest, and some physiotherapy. If symptoms are very severe or patient is not getting better with simple rest, medication, or a physical physiotherapy, then we go for some advanced tests. Are there any specific tests for sciatica once it is diagnosed? Yes, we do have. Once a patient pain is not coming down with simple medicines or pain is extremely painful, severe, then we do some advanced tests in the form of X-ray, lumbar and sacral spine, MRI and CT of lumbosacral spine. This test assess the health of the disc, health of the bone, facet joints, SI joints in the lower back, which are the most of the common causes of sciatic symptoms. With these tests, we can specifically pinpoint the area of pain generator where the pain is coming from causing sciatic symptoms. What lifestyle adjustments do we need to make to alleviate these sciatic symptoms? Once we diagnose a patient having a sciatic symptoms clinically and do some tests and diagnose if patient has a mild disease, moderate disease or severe disease, first comes is the lifestyle modification. If patient has mild to moderate kind of a disease in the lower back in the form of disc prolapse or facet joint disease, we ask them to have a good lifestyle change starting from their routine habits like the way they sit, the way they sleep, the way to do exercises, and work style adjustments where they need to do a proper ergonomic way of working at the workplace. And third thing is the recreation adjustment where any kind of sports or exercises or gym they are going, they need to have a scientific way of doing it. So this proper lifestyle adjustments can alleviate most of the pain the patient comes with. The next comes the workplace management where which is very important. So half of the or more than two-thirds patients gets better just with the proper workplace management in the form of sitting postures, frequent breaks, and simple stretches at workplace. After that, we teach them simple exercises where they are mostly extensor exercises where bending backwards so that their disc is in proper position, not getting aggravated, and they can strengthen the muscles. So the purpose of these exercises are to strengthen the lower back muscles and the core muscles where they can sit, stand, or work for longer hours. This basic core muscles and back strengthening exercises are the key for any sciatic patient to get better. There are other advanced exercises. Once a patient start doing these basic exercises, we teach them the advanced exercises. Are there any home remedies or over-the-counter drugs which can alleviate sciatic symptoms? This is commonly asked by the patients. A simple caution to everyone is that never try over-the-counter drugs because most of the over-the-counter drugs are analgesics or painkillers which might harm their kidneys and their health, overall health. So always a proper clinical consultation should be taken before starting any medical treatment. Home remedies in the form of just hot water bag fomentation, rest, and gentle stretches will help most of the patients. When should I seek a professional help or a medical help, and what are the options? So whenever patient has what we call as red flags, what are they? Severe low backache, unable to move. There is a weakness in the leg, the ankle or knee. The patient is not able to move or lift. There is problem in urination or passing motion. There is loss of sensation in the limbs or in the private parts of the patient, or both limbs are numb and patient is not able to move. These are the red flags. Whenever patient has these symptoms, he should rush to the doctor. Or when patient has tried all measures in the form of rest, exercise or physiotherapy, still is not getting better, he needs to see a specialist immediately. What are the treatments available today for this sciatic symptoms? As I said before, most of the sciatic patients get better with simple rest, medications, exercises and physical therapy. If they're not getting better, things are getting worse or chronic, or patient never improved, then he needs some urgent attention. On investigations, if it is found to have that there is a significant disc problem or a facet joint problem which need to be addressed, or any surgical therapy is required, so after failure of medical management, we try some in between therapies like pain management, where we can try a injection in the form of epidural or transforaminal injection or a facet injection using steroids and other local anesthesia drugs, which sometimes help the patient to relieve pain, reducing the inflammation. That pain management sometimes become one-time management where patient might not get pain again. Even if that fails, then patient has one option in the form of surgery. So what are the surgical options available today? For spine surgery, all these years there were two options. One is open surgery, second one is microscopic surgery. Now a third technique, or the latest or least invasive technique, has been added. It's called endoscopic spine surgery. So when you compare all the three, open surgery, microscopic surgery and endoscopic surgery offers the least invasive method, where without cutting any muscle, bone or any blood loss, we can tackle most of the problem with endoscopy with a small as 7 to 8 millimeter incision. With this, 80 to 90% of the spine problems can be tackled today. What are the long-term implications of sciatica if it is left untreated? And what are the complications if you don't treat sciatica symptoms? Even after diagnosing that there is a problem and a patient is not getting better with medical management or the pain management, what it can do to the patient? This disc which has come out, or the facet which is compressing the nerves, chronically left untreated, this might cause permanent deficits in the form of foot drop or the weakness in the limb, where patient is not able to lift his leg or foot. He has to drag, crawl, and sometimes if it left more severe, it causes urinary retention where patient cannot pass urine, or constipation where patient cannot pass stools. This we call as cauda equina syndrome, which is the worst complication, where patient nerves below the lower back causes compression and leads to permanent deficits. So whenever a patient is not getting better with medical management or pain management, it should not be neglected. It should be attended as early as possible to prevent permanent deficits. Today, with the endoscopic spine surgery, we have the least invasive approach where we can do an excellent outcome without damaging any nerves.